My name is Faizal Kolawolu Folarin, and today I am here to interview Senator Mamoora, Honorable Minister of State for Health in Nigeria, about how Nigeria is dealing with the COVID-19 pandemic. Good morning, Senator. Thank you for carving out the time for this interview.
Thank you very much. Faizal, good to see you.
Thanks. The first question. Since you are from Lagos State, sir, why is your state the epicenter of the pandemic in Nigeria, and what measures are being taken?
Well, there are so many reasons responsible for Lagos being the epicenter as of now. First is that you recall that the index case that came into Nigeria arrived in Lagos. An Italian business consultant arrived in Lagos. That's one. That is, the index case in Nigeria was first recorded in Lagos. Two is that Lagos State is the most populous state in Nigeria. So, I'm saying, in essence, there's an issue of population. And it's not just the population alone, the population density as well. You know, Lagos has a very small land area, but it has large water, bodies of water. So, that accounts for the population density. That is, a small area with a large population. That's the second. Third, the other factor is it's also the commercial nerve center of this country. So a lot of commercial activities going on in Lagos, So, which means, aside from the residents in Lagos, a lot of people come from all over, not just from Nigeria itself, across from foreign lands. They come to Lagos for one business transaction or the other. So that's also a factor. And then there's also the factor of as a center of commerce itself, that in itself attracts a lot of activities. So when you put all this together, it shouldn't be too difficult to understand why Lagos is the epicenter at this point.
And what measures are being taken in Lagos, seeing as it is the epicenter of the virus?
Yes, I can tell you that Lagos, when you juxtapose the state with other states in the country, Nigeria has a 36 state structure with the Federal Capital Territory, Abuja. And when you look at in terms of response to COVID-19, Lagos has done very well, whether in terms of infrastructure set up to respond to COVID pandemic, in terms of isolation centers, treatment centers, in terms of personnel, in terms of the response activities, even the capacity to respond. One, you will recall that again, Lagos has experience behind her. What do I mean? Not too long ago, we had this case of not a pandemic, there was Ebola. Ebola situation. The patient also arrived Lagos came from Liberia. Yeah. So Lagos had experience. So taking cognizance of the experience of the past, Lagos was able to build on that to also respond to this present situation. Lagos is probably one of the very few states that has infectious disease hospital already there. The infectious disease hospital is already in existence, and of course, all that needed to be done was to expand the facilities, and then, of course, be able to take charge. And of course, Lagos has so many centers. You have teaching hospital. You have the Federal Teaching Hospital in Lagos University Teaching Hospital. You have the state, Lagos State University Teaching Hospital. You have so many other hospitals, private hospitals. You have medical laboratories. Of course, part of the commercial activities of Lagos. So Lagos is able to respond and has what we call the human resource, the human resources for health. Human resources for health available to cope. So it wasn't too difficult to deploy all these facilities, human resources for health, for infrastructures needed, and of course, even the funding. Lagos has, when you look at no other state has the level of IGR, internally generated revenue, Lagos has to cope with all this. So all this has been deployed, and of course, I must also commend the governor, and his team. The governor, for example, is the chief incident officer for COVID-19 pandemic in Lagos. So the governor is taking charge himself, and of course, he has his lieutenants and other members of the team from the Commissioner of Health, Professor Ayo, who is also well experienced public health physician. So a whole lot of team that have the competence, the ability, the capacity to respond. And so Lagos has been doing very well in terms of response activities. And of course, the thing in COVID is that you must put in place your surveillance, and then you must identify cases and test. Test is very important, because majority of the cases, over 80%, they may not even show any symptoms. So until you test, you cannot determine who is positive and who is negative. So testing, and the testing capacity in Lagos is so high, both from the public sector and of course from the private sector, through the network of laboratories that are available, too. So Lagos has been doing well in terms of, and of course, if you look at the figures from Lagos now, you can see Lagos is almost at peak now. Now, some of these vaccine processes, they are being managed or quote unquote supervised by the WHO, that is World Health Organization. In fact, the WHO has its own vaccine program where various countries are involved, and countries are encouraged to have a buy-in. But aside the WHO, there are so many individual countries, the US, the UK, Russia, UAE, name it. They are also involved. It's a kind of struggle. Everybody is working towards producing a vaccine, and which is good. The more the merrier. Once this vaccine, because it's a process, and don't be surprised that at the end of it all, the vaccine that comes out efficacious for COVID-19 will probably become the fastest vaccine ever produced in the history of mankind. Because normally, when you see from the process of conceiving a vaccine to when it goes through clinical trial, which are in 3 phases, phase 1, phase 2, phase 3, and going into final production and making it available, particularly in commercial quantities, normally it could take up to even 20 years. But on average, maybe about 10 years, maybe 5 to 10 years. But I can assure you, COVID is not about how many months now? About 9 months. But from what we are seeing, in terms of the race and the determination to get a vaccine out, it will probably be the fastest vaccine ever produced in terms of period. So, and it's good, like I said, the more the merrier and the better for the human race. So, as it is now, we are beginning to, some of the countries are already, telling us that they have been able to come up with a vaccine, that will be out there for use even by December of 2020, which is just a few months away. So that would be, in fact, that would probably qualify for Nobel award, yeah, Nobel Prize. If that really happens. But again, even when the vaccine invariably gets available, you also follow up. When you do the human testing, you follow up to be sure that it's safe, because safety is important. So it has to be monitored by you. But back to your question, yes, we are part of that in terms of we have our own Nigerian group working, working in there, and we are not even we are not restricting it to the Western world. So when I say we're not restricting to, we are even talking of our own traditional medical practice or herbal practice. Because if somebody can also give us something from herbs that will work, why not? So, after all, for centuries, our great grandfathers, they were relying on these herbs. So we in essence, or let me just say that we have the National Health Research Committee that is working on their own. We also have the what we call the TCAM, that is Traditional, Complementary and Alternative Medicine Group 2. They are also working. So whichever way, the important thing at the end of the day, we want to be safe from this global scourge that COVID-19 is. That's it. So we're not left out. That's just it. That's just the bottom line. We're also doing our own bits, and so it's like the rat race now. But what does it matter? At the end of the day, we want to save humanity from this scourge of COVID-19.
Well, I will reiterate. Thank you very much, Honorable Minister, for carving out the time in your show. And I'm
situation is clement. If it's not, if it's not raining, the students can sit exams. They can sit for the exams right even on the field, so that we can, create physical distancing. If the weather is okay, why not? They can sit for the exams right on the field. We just bring the chairs and tables to the field so we can. So these are some of the measures that are being put in place and being worked upon to ensure that reasonably some measure of protection is put in place to still enable us, achieve our goal. And the bottom line is that, look, where there is way, or where there is will, there's always a way. So that's the bottom line, so that we can still get our students to graduate, sit for the exams and graduate, and able to move to the next. That if we can move from the initial figure of 4 laboratories to about 62, that tells you that we are very concerned with the need to do our testing and ramp up this testing, which is critical. I just mentioned that earlier on, that testing, because the whole approach is to test and isolate. Because once you test, then you know that a candidate is positive, you isolate. And when you isolate, you reduce the tendency for transmission to people around. And most states now in Nigeria, they are already in the phase of community transmission. So it's even difficult to do contact tracing as much now as like before, because you may not even know where it's coming from. So the efforts, and of course we are still going on to increase this number of laboratories that are available. So in fact, what we are looking at is, aside setting up laboratories, we're also looking at setting up, which some states already have, what we call collection centers. That is, these centers may not have laboratories, but they have collection centers where the samples can be taken and then transported to laboratories for testing. I think, and the goal, at least from the point of view of the Federal Ministry of Health, is to ensure that we have at least one collection center in each of the 774 local governments in Nigeria.
Next question. So, what measures have government put in place pending the resumption of schools?
Well, you see, that has been a very thorny issue. Resumption of schools. It's been thorny. It's even been emotional somehow. Especially with parents. There's bound to be some anxiety, because we are talking of students, pupils, and we are talking of even kindergarten, small children. And how do you begin to achieve social distancing or physical distancing among small children whose natural tendency is to hug themselves, to play around and all that? These are the things. So you can understand why it's an emotional issue, especially to parents, and of course to those of us who are privileged to be where we are in terms of getting involved in policy formulation and all that. And so that is the thing, and that is why. That's one. The other thing is that we also, what we are doing essentially is based on 3 things: science, evidence, and data. So we are also looking at what is happening in other climes. What is happening, and what we have seen by way of evidence is that some of the countries where they have reopened schools, they suddenly, they discover that the figures go up, which is not unexpected because of what I told you earlier on, the natural tendency for people, to mingle, it's difficult to say, children that you put in a class, and you now tell them that you have to do social distancing or physical distancing. How do they do that? Children. It's not in their nature. So that is why we are being very careful. So what we are doing is to look at exit classes. That is, for example, the educational system here, you have when you get to SS, Senior Secondary 3, what we call SS3, that's the exit class. That is for the primary school, and secondary school rather, because at that point they now have to go to colleges, that is universities or technical colleges or whatever. So for those ones, because they will have to sit for exams that some of these exams are not just exams in country, that is within Nigeria. Some of the, like we have the West African Examination Council, which goes beyond Nigeria, because there are some other West African states that are involved. So we have to key into that. So for students in that class who will have to sit for exams that goes beyond Nigeria, then we must consider them. So those are the class of students that we are focusing attention on, exit classes, to enable them to do their exams so that they can then, because it is the basis of, is this exam that will form the basis for which they can seek admission into universities and colleges. So that's one. But that's not to say that we don't have certain exams that are in country. That is, the exams managed. There are examination bodies that manage examinations within the country. Like we talk of you have these exams, which they do around here. That is, they are not external, they're just within. You have like the JAMB. JAMB is a joint admission matriculation body exam. JAMB, and that's local. That's Nigerian thing. Those are some of the exams. That's one of the exams that they were used to. They also have the NEC, National Examination Council. That's in-house. That is within the country. So, but these are exams that they need to sit for. So we must prepare for them for this. In lieu of that, that means the student will lose the whole year. And if they do, the implication. That means even the students from lower classes, they cannot move, because the ones that are ahead are supposed to sit for a certain exam to make them exit. They cannot. So you can see the complication and how and why we need to manage this carefully. So we are looking at that. But having said this, in terms of other part of the preparation, that is now for us to ensure that what we call the non-pharmaceutical intervention measures are put in place. That will now be that we want to be sure that to start with, because we have reduced, we're not asking all the students to resume schools. We are saying the exit classes. So which means that we will now have fewer students going to these various schools.